So this person has gastritis and dyspepsia now for 2 years. Gastritis is very common in general, but I would definitely recommend, especially if this person has a history of breast cancer or stomach cancer in the family, go through endoscopy, at a regular interval. That's all I would say. Definitely have a endoscopy done. If there is H. pylori, make sure that you get treated for that. That's all. That's it.
All right, sounds good. There's a very good question on CTC versus ctDNA. I can take it. It will take a little bit of time, but I will tell you one thing. The cell-free DNA that is floating is, and the circulating tumor cell. Circulating tumor cell has 100 times more information, at least 100 times more information. Unfortunately, it's very difficult to capture, very difficult to isolate. And in fact, I've spent now several years and really focusing on how do you utilize the information in circulating tumor cell to help monitor the patient journey and that sort of stuff. So it's a very interesting area. You will see over the next 5 to 7 years, the liquid biopsy transitioning from cell-free DNA or ctDNA into ctcDNA. That's where the technology is heading and that sort of stuff. So current practices are all around ctDNA, but they will, sort of transition over.
Yes, it was a wonderful panel, and I learned a lot from other panelists, and especially other lifestyle changes and nutrition. I'm myself a big believer in other healing methods other than, I practice Western medicine, but I practice yoga and Ayurveda too. So I'm a big believer of all the aspects of healing, and definitely prevention is the key. Once you find the cancer early, it's still finding the cancer. It's not prevention. Please feel, be happy, exercise, eat good, and make sure that you assess your risk categories and get proper, attention when you feel that you're a high risk category.
Thank you, Dr. Sangeeta. Dr. Srikumar?
Yeah, it was a fantastic session. I think I have enjoyed all the speakers and it was really good. And from my experience, I will say, because for the last 20 years, more than 20 to 30,000 cases of cancer and other prevention and other strategies, I will say metabolic balancing that I have seen is, okay, I will take the fear of cancer out of the person's mind and then make their body balance with the metabolism and their lifestyle. So that is the best way of, I will say that, okay, the prevention is actually one of the most important thing that you are doing today is education. Education to inspire to become powerful, and then that is actually necessary to prevent most of the diseases.
Scientific research and conventional medical research work today about meditation, about yoga, about power of breathing. And I'm very grateful to Sachin that he mentioned very important words such as compassion and altruism, right? But the question is how all of it is connected, because it's all like different fragments, how to use it. In Dr. Buteyka's method, it's not another technique or another treatment, not at all. It's a unifying factor which helps to understand how all these elements, whether generate prana or take away prana, making a person healthier or less healthy. And from his perspective, from my perspective, actually, all answers are in the Indian culture, but they need to be decoded through science. And Dr. Buteyka started doing this very important work, and I hope that it will benefit all of us and all sentient beings in general.